here with Laura Ross and Sarah Wright to discuss today's campaign announcement. Laura and Sarah are both Saskatchewan Party candidates. They're also both cancer survivors and strong advocates for women's health care. And they both understand the importance of early detection cancer diagnosis.
The Saskatchewan Party wants to make it easier for women to screen potential cervical cancer. As a re-elected Saskatchewan Party government will introduce self-screening as an alternative to the Pap test.
Saskatchewan women between the ages of 25 and 69 will be given the option to receive a self-sampling kit in the mail to screen for HPV, the leading cause of cervical cancer. Saskatchewan will become the second province to offer self-screening as an alternative to the Pap test. I'm so proud to be part of a political party who not only supports women's health, but is raising the bar for care of women in Canada.
We also want to make it more affordable for families to access fertility treatments. A re-elected Saskatchewan Party government will provide a 50% refundable tax credit to cover the cost of a first fertility treatment and related prescription drug costs to a maximum of $20,000, which means a $10,000 benefit. Improving access to women's health services, it's part of our plan to ensure the best possible quality of life for everyone in Saskatchewan. The early detection is what this announcement is about, specific to making the detection method more convenient and more available.
The home tests for cervical cancer, that's really big. How do we provide health care better? And this is one way of doing it, because instead of tying up a doctor's office, right, this person can do it at home. And then you have options, right? So that when cancer is detected early, you can then put together a program with your physicians, with the surgeons. How do we best deal with this and make it as least invasive, but also less scary?
Yeah.
When you have had experienced cancer as a woman, you're susceptible to other cancers as a woman. And having the support and the prevention right from the very beginning at a young age is a complete game changer. And so as we go ahead further and further into the new generations of Saskatchewan women that will have their mammograms at 40 earlier than most of Canada. It's huge.
Really big.
That's huge. All of those things they're just going to become routine surgeries. They're not going to become cancer battles.
Yeah.
And that is quite literally why I sit here as well.
Yeah.
And I'm so grateful for our healthcare providers, because once you're there and it's your time to be treated and taken care of, and you're at the right point for all of the things to come together,
yeah,
to solve your health problem. The healthcare providers, they couldn't be more kind, more gracious, more patient, knowledgeable. Yeah. They provide so much more support, I think, than maybe even they realize sometimes. Sometimes just a smile and an arm around the shoulder says everything.
Yeah.
And they take the time to do that. Yeah. And, I'm just very grateful for the experts that we have that help us along the way in Saskatchewan.
We're very fortunate here because we do have a healthcare system that is paying attention to people, right? That's the best part about it. And when you look at
how I sit here today.
Exactly, and also the conversations we get to have, with our healthcare providers. They really do. They want the best for all of us, and that's to them. It's not just a job, right? There's a calling there, and I think that's what makes it different too. It's that people, they're passionate. They're passionate about what they're doing and how they can help you. And that's, I think, what, you feel good. How can you say you feel good? But you do. You feel like, man, these people, they've got my back.
But I would just say one other thing, and it's the courage of conversation that survivors have. Like the two of you with so many other women, whether you meet them on the doorstep or wherever, and in the that courage is admirable and so very valuable. And I saw it with our family as our mother-in-law faced it and our family faced it. The courage that you provide for so many others is a real blessing as well.
Yeah, we're not afraid to share our stories and hope from our journeys that we can help others.